We want to welcome to the program Dr. Michael Warren with the Tennessee Department of Health. Thank you so much for your time today.
Absolutely. Thanks for having us.
Sure, it's a pleasure to visit with you. We're talking today about preterm birth. And if you can, give us the medical definition, Dr. Warren, please.
So when we talk about a baby who's born preterm, we typically mean one who's born before 37 weeks of gestation. So pregnancy, typically we think about being 40 weeks. People tend to think 9 months. It's really closer to 10 months, 40 full weeks. And so if you're born before 37 weeks, that classifies you as a preterm birth.
All right. You always usually hear from your doctor how important those last weeks are for the baby's development. Specifically talk about how the baby develops in those last weeks.
Absolutely. So we know that if you look at a baby who's born at 35 weeks compared to a baby who's born, say, at 39 to 40 weeks, their brain at 35 weeks is only about 2/3 the size of what it will be at 40 weeks. You think, well, it's only 5 weeks, but that's a massive amount of brain growth.
Sure.
And if you think about the job of little babies in those first few weeks and months, they need to be able to eat and sleep and regulate their breathing, and that brain development really helps allow them to do that on their own. And so those last few weeks are absolutely critical to be able to do those very basic things that babies need to be able to do.
Sure. What would you say are the biggest risks for a baby who is born preterm?
So related to the things we just talked about, many times they don't feed very well, and a lot of this has to do with how preterm they are. So if a baby is born, let's say 28, 29 weeks, they're going to have more possibility for severe complications or more severe complications than, say, a baby who's born at 34, 35 weeks, although even those 34, 35-week babies can have complications, but things like difficulty feeding. So sometimes we have to feed those babies through an IV or even a special feeding tube. If they're born very premature, they may have difficulty breathing. So sometimes those babies are on ventilators to help them breathe for those first few weeks of life. And so those are the main kinds of complications that we see. There are others. Sometimes babies come preterm for a reason. Perhaps mom has a medical problem or baby has a medical problem. And so if that's what prompted that preterm birth, then there may be other issues associated with that, say congenital heart disease or a lung disease.
All right. Well, usually all of our focus is on this new amazing life, but there is risk for moms too when we're talking about preterm birth, correct?
Absolutely. So sometimes a medical condition that mom has may be what prompts the baby to be born preterm. So maybe mom has an underlying chronic disease that contributes to that baby being born preterm, and so there may be medical complications. I think one thing we tend to overlook sometimes is the emotional and psychological toll that preterm birth takes on the family. And so we're focused on caring for this little baby, and yet we've got a mom and a dad or a partner who are, preparing for this healthy baby who's now maybe in the intensive care unit. And so when we think about complications for the family, we really need to think broadly about what's the impact of that baby being in the NICU. And folks always expect that perfect baby and that absolutely healthy baby, and when things don't exactly turn out like that in the beginning, it can be pretty traumatic for families.
Sure. No matter if the mom has a predisposed medical condition or whatever the situation is, because I know each pregnancy is different, are there general warning signs that all women should be paying attention to that signify a preterm birth or likely preterm birth?
Sure. So one of the things we know is as women get closer to delivering, many times they'll start to feel contractions or feel pressure.
Sure.
If women feel those signs early on during pregnancy, those should be red flags. If they have vaginal bleeding during pregnancy, that would be a red flag as well. This sort of vague sense of pressure they may feel in their abdomen or their lower stomach, those would be signs that would be concerning as well. So I think one of the things we always like to tell parents and individuals in general, you know your body the best. If something doesn't feel right, call for help. And just, it may mean calling your doctor's office and saying, here are the symptoms I'm having, should I be worried? And never feel bad about doing that.
Sure. Dr. Warren, just so folks have a really good idea as what we're dealing with here in the state level for preterm birth, what are the statistics?
So we have, in general, about 80,000 births a year in Tennessee.
Okay.
And about 11% of those, or just under 9,000, are born premature. So those are, again, those babies born at less than 37 weeks. So about 1 in 10, 1 in 11 babies. And what that means is if you visit hospitals across the state, we've got preterm babies in most of those NICUs who may be there for a few weeks. Some of them may be very sick and may be there even for a few months till they're ready to go home.
Okay, in recent years we've heard the term of elective deliveries. Can you kind of explain what that is?
Sure. So as we've gotten better from a medical standpoint about being able to take care of these very small babies, you know, years ago folks would say if a baby was born before 27, 28 weeks, the chance of survival was very low. Now that number is back closer to 24 weeks. And so sometimes we think because we can provide all this great medical care that it's okay if the baby comes a few weeks early. And so what we see happen sometimes is you may have a provider who, for whatever scheduling reason, says, we're going to go ahead and schedule this delivery earlier. Maybe you have a family who says, you know, dad is going to be deployed or family is going to be visiting from another state. We really want the baby to come this week. And that's convenient, but what we forget is those last few weeks are so incredibly important. And so if we cut those off and bring that baby into the world, we can deliver the baby and care for them, but it's not without complications.
I was just going to say, personally speaking, my doctor did not allow that at all. It was just like the baby's going to come, whether I deliver or someone else does.
Right.
We can't have a perfect scenario. So I guess give us the main reason of why it's not a good idea to try to do something like that, to have that elective delivery.
Sure. So babies will generally come when they're ready, and they let mom know when they're ready to come, and you sort of have this normal physiologic process. When you alter that process, you may have to induce labor in the mom. That doesn't always go well, so you try to induce a vaginal delivery, but sometimes that doesn't work and you have to convert to a cesarean section. So now you've got a mom who was anticipating a natural delivery who's now having a surgical procedure. So that's a procedure that didn't need to happen. But again, it also gets back to that baby really isn't ready from a physiologic standpoint to be born, and so they're going to need some additional support, whether that's from a feeding or breathing standpoint.
All right, Dr. Warren, you have traveled the state extensively and obviously have educated other doctors, talking to them about trying to reduce preterm birth here in our state. What has the response been like from educators and physicians alike, and how trying to reduce that number?
There's really been a tremendous response across the state. So our department has partnered with the March of Dimes, the Tennessee Hospital Association, the Tennessee Perinatal Quality Care Collaborative, and worked with all of those folks to say, let's try to reduce those early elective deliveries. Now, if a baby is coming early because of a medical problem, either in the baby or mom, those are going to happen. We're not trying to stop those, but those elective deliveries. And so many hospitals have instituted what are called hard stop policies, meaning if an obstetrician tries to schedule a elective delivery or induction prior to 39 weeks, the folks in that hospital are empowered to say, maybe we shouldn't do that. Maybe we should make sure there's a medical reason before we do that. So that's one side. There's been a lot of effort too with consumers to say, how do we make sure folks know that truly we should wait till 39 weeks because a healthy baby is truly worth the wait.
You touched on this a little bit earlier, but kind of go over some of the medical complications a woman might face, pre-existing conditions they may have, that will definitely send them along that path for preterm birth.
So one of the most common things that we see in Tennessee is tobacco use. We know in general about a quarter of our adult population smokes. What's surprising to a lot of folks is that 16% of women smoke during pregnancy, and smoking during pregnancy is absolutely a known risk factor for preterm birth and low birth weight delivery. So that's the most common. Other chronic diseases, diabetes, high blood pressure, conditions like that may also predispose that mom to a premature birth or other complications.
So many important things really to think about,
Absolutely.
Obviously, when you're even talking about conception and then when you're actually pregnant. So obviously consult with your doctor on all of these kind of things.
Absolutely, and our key take-home message is let's focus on being healthy before you ever become pregnant. You can't correct lots of health problems in 9 months. So if you're healthy when you get pregnant, that's the best solution.
Dr. Michael Warren, thank you so much for your time today.
Thank you.